we're learning more and more how the planets influence us. I'm studying medical astrology right now, and there are these galactic and cosmic rhythms that influence us. I don't know if you watch Stephen Burns' YouTube, but he talks all the time about what's happening in space and how that's affecting Earth.
Mm,
And in my early career, I had patients that told me that they were influenced by solar flares. And I'm like, what are you
yeah.
talking about? But now we understand. Roland McCready, taught me how the plasma from the sun can affect the magnetic field lines of Mother Earth, and that can affect our, energetic system.
Welcome to the Beljanski Cancer Talk Show, where integrative science and holistic healing come together. I am Sylvie Beljanski, and in each episode, we explore nutrition, lifestyle, mental health, and research-backed approaches to support the whole person through cancer and chronic diseases. Hello, and welcome to this new edition of the Beljanski Cancer Talk Show. And today, I have the pleasure to welcome Dr. Christine Schaffner. Dr. Christine Schaffner is a naturopathic physician with over 16 years of experience treating complex, chronic, and multi-system illness. She bridges bioregulatory medicine with principles of biophysics. Those principles help support the multidimensional human, addressing nervous system dysregulation, immune imbalance, chronic infections, and environmental illness through a whole system approach. Her clinical work integrates advanced generative therapies with bioresonance and precision muscle testing to assess regulatory coherence across the body. She is known for listening deeply, working with compassion, and guiding patients who have not improved with conventional or standard functional approaches. At the heart of her work is a belief that healing is not only about removing stressors, but restoring regulation and helping patients reconnect with their own inner navigation system, building resilience, clarity, and long-term vitality from within. Dr. Schaffner, welcome to the show.
So nice to see you again, Sylvie. It's always a pleasure to connect with you.
Thank you so much. So I like to ask, how did you get there? You did not grow
Yeah.
up thinking you would have a different approach and you would come up with a multi-dimensional new way
Yeah.
to see patients. How did you
Yeah.
get there? Tell
Yeah.
me about your journey.
Thank you. Yeah, I definitely, if you asked me when I was like 7, if this is what I would be doing, I probably knew a little bit of this, but not to the depth that my work has taken me. But I grew up in medicine. My father's actually an oncologist. My mother is a nurse and she was in education. And so I was always around medicine. I always loved the sciences. I would say when I was in my teenage years, I gravitated at that time bookstores where they had, a lot of sections on science and spirituality. And I remember just from a young age, just asking deeper questions and the why. I'm a Sagittarius, and I think we're all about truth and spirituality and science. And really, my path has led really weaving these philosophies and these sciences. And so I took a windy road, but I, stood my ground and became a naturopath rather than a medical doctor. I went to Bastyr University in Seattle, and that really gave me not only the depth of the science that I needed, but I explored all these different modalities. And so I knew when I was at school that I didn't want to just do like green allopathy, where I just give like a pill for this, a pill, instead of a pill, like a supplement, right? I didn't want to just do that. And I had a really memorable moment where Dr. Louisa Williams came to my school and she did a brown bag lunch and she wrote the book Radical Medicine. So she kind of wrote the textbook of the time for bioregulatory medicine. And I just resonated so deeply with her conversation. And I remember to this day, she says, "What's the first thing that you do with each patient?" And we're like, "Diet, gluten, all of these things." And she said, "No, you look in their mouth." And that really inspired me. And so I would just take that book around, it was before Kindle, and I would just take that 1,000-page book around through osmosis. I ended up reading the whole thing at one point, but I was really inspired the opportunity to have really great mentors. I had mentors in bioregulatory medicine, which is a form of medicine that came out of Switzerland, Austria, and Germany. And it bridges so many philosophies, but at the core, it's all about that. We don't have to fix anything. The body is wise and intelligent, and it's up to us to be detectives to understand what's dampening that intelligence, what's interfering that intelligence. And it gave me a lot of tools. Every patient I see, I still go back to, my bioregulatory roots because they help me get momentum, especially with patients with chronic illness. And so I started my practice, and I've been practicing 16 years through mentors and so much study. And ultimately, my patients teach me. I think we don't set out to become specialists in cancer or chronic illness, but we see that our patients need this philosophy, this framework, these tools, these therapies, because I don't know about you, Sylvie, but I think people are just getting sicker, more complex, and it stretches us. So yeah, that's the very, cliff note version of how I am, how I got here today. And again, I'm very inspired by my patients, and I have turned to physics and quantum biology and quantum physics and spirituality to deepen my own personal experience. I've also been on a healing journey, like many people that you've talked to. I had a benign brain tumor in 2022, but it was large enough that I had to have surgery because it was going to give me a stroke or kill me if we didn't find it. And that was a long journey. But I was inspired at the time of the work of Dr. Joe Dispenza. And I know I had to do conventional work to get surgery in order to move beyond this, but I was able to pair that with a lot of the things we'll talk about today. So I only had 2 weeks to prepare for the surgery. So I really leaned into this idea. When you change matter with matter, it takes time. But when you change the field, you change matter. And that's what Joe says. And so I did a lot of energy healing, a lot of meditation. I was in that moment where, I can really observe the outcome that I want in this experience. Sometimes we don't understand why things happen in our life. We can, make up all these assumptions, but there's mystery, but we can choose how we move through things. That gave me a strength in my commitment to what I share today. And I had validation from my neurosurgeon where he said to me on my follow up, he told me when he looked at the pathology report that my tumor was very different. And he was going to study my tumor for a long time because he said that I want to know why it came out so easily. And that was a lot of the meditations, the energy work, the visualizations. And he does 400 of these a year. So that was to me okay, yes, I had to go through surgery. I could, make up a whole, slew of things of why this happened. But again, I chose in that moment how I wanted to move through that, and it mattered. So I feel really passionate about empowering people and inspiring them to do the same in their life.
Absolutely. This is an amazing story, and thank you for sharing. You are, I mean, there are a number of physicians now, especially in the realm of cancer, who are
Yes.
speaking of the terrain. Discussion of the importance of the terrain is going back to Pasteur and Bréchamp
Yes.
in France at the 19th century. So it is not new, but what you are bringing is this notion of multidimensional terrain. And what does it mean? And how is it different from the traditional just root cause model? When you are facing cancer, you are suddenly facing a myriad of questions. Questions about nutrition, lifestyle, mental and emotional support, and how integrative approaches can work alongside conventional care. The Beljanski Integrative Cancer Conference brings the conversation together in one place. From June 26 to 28, join leading oncologists, integrative physicians, researchers, and survivors in San Diego, California for 3 days of science, informed whole-person cancer care. These live events explore evidence-based integrative strategies, emerging research, and practical tools you can apply immediately while connecting with a community that understands the journey. Whether you attend in person or virtually, this conference is designed to educate, empower, and support informed decision making. Learn more and reserve your spot at integrativecancerconference.com because better outcomes begin with better
Yes.
conversations.
Yeah. Thank you. And again, I'm always evolving my philosophy and my framework based on my experience and what patients share with me. And part of bioregulatory medicine with what I was trained in is, terrain theory. It's completely opposite from germ theory. And we focus a lot on the extracellular matrix, which is really important for the health of the cell and the mitochondria and to help us have optimal genetic expression. And so what I have evolved this, we are very much physical beings living on, this planet, and I don't ignore our physicality at all. It's a lot of what I'm doing in the treatment room, but my questions are kind of as I, really explored these ideas that were inspired by me by the statement, when you change the field, you change matter, and what that really looks like. And so I have studied a lot about this and I explore it in my own practice, but how I've laid it out, and I'm sure it will evolve, over the years, but I think about that we're, of course, beyond our physical body. And a lot of us talk about that nature. And we might talk about the biofield or we might talk about the unified field. But I'm really, like, okay, how does this all work? And so, at my current understanding, I talk about our physicality, which is a lot about our regulatory systems, our autonomic nervous system, our extracellular matrix, our lymphatics, our organs of elimination, a lot of what we're treating people in our clinics. And then we know that we're electromagnetic, right? Conventional medicine knows that. We very much know that in terrain theory as well. We talk about voltage and pH. We talk about heart coherence and brain coherence and the connection between the heart and the brain and our electromagnetic nature. And we know that we are full of charges moving through conductors and we create electromagnetism in our body. So we have this, electromagnetic nature. And then I share that we have our emotional nature. We are very much human, living a human experience, and we have emotions that we carry from past experiences, current experiences. And those emotions can get stored in our limbic system, stored in our organs and our tissues. They can get stored in our field, and they can, just as much as a toxicant or an infection, dampen our intelligence of healing. And that can be a roadblock. And so a lot of healing is excavating and bringing into our awareness our emotional terrain. And it's a very big part, I think, of the healing journey. We also have this ancestral kind of epigenetic nature. It's been studied, especially with survivors of the Holocaust, that there can be, when a family member from a, up to third generation that has even passed, if there's unresolved or very traumatic experiences, it can create a ripple effect in our epigenome. And, there are wonderful tools to bring awareness to that and even change that, which is really incredible. So we can really influence our epigenetics by liberating and bringing awareness to our ancestral trauma. We weren't created in a vacuum. We have a lot of people who came before us that created our life. I call this layer because it is multifaceted. I call it the crystalline architecture. So we can look at fascia very much as a structural component, but we can also look at what I call the living matrix from Dr. James Oshman's work, that we have this beautiful connection between our skin into the nucleus of our cell that doesn't just create a structural fabric, but it's actually a communication network. And this is the network where electricity runs, where biophotons communicate, where energy medicine works, right? We're influencing this whole body wide system. This could be our acupuncture system. May Wan Ho found that, our acupuncture meridians are within the fascial, fabric. And so it's this other lens of communication that happens in our crystalline architecture. And then I kind of talk about the biofield and plasma. So I love the work of Beverly Rubik and Eileen McCusick. They inspired me to look at the biofield, and we're still learning about the biofield. We talk about it, it's our electromagnetic nature, but there's also this idea that it's our plasma nature. And plasma is the fourth state of matter, and it influences what comes from, maybe the higher fields, that kind of density, and it's kind of a bridge between the outer ether and into our 3D body. And so it can store information, it can definitely shift and change and influence our physical body. And we have plasma in our body as well. We have plasma in our blood. We have plasma in our CSF, which is our craniosacral fluid, and our cerebral spinal fluid. We have plasma in the fourth phase of water that's throughout our body. So it's this idea that we are plasma beings, and we have a plasma biofield. It is a connection between where we come from and also this other part of us. Plasma is full of these ionized gases. It's a charge separation, which creates a lot of energy, and it creates matter, it creates life. And when it's distorted, we can have distortions in our physical body. And then I also talk about, this is something that I'm still noodling on. There was a book called The Holographic Universe, and it's talking about that we are, 3D holograms from a larger energy source. So Joe talks a lot about this too, that when we want to change our, operating system and change our physicality, we have to go upstream. Where is there interference in our source code, right? And that's takes us, depending on your belief system, on a spiritual journey. And then there's two more that I talk about. I love the work of Nassim Haramein and the unified field theory, and also Tesla's, Einstein's ether philosophy. I think we're all interconnected, in space time, outside of space time, within our bodies. You and I are interconnected. I know you're across the country and I'm here, and we live in an interconnected universe. And we also live in this cosmic, yeah, and we live in this cosmic universe too. We're learning more and more how the planets influence us. I'm studying medical astrology right now, and there are these galactic and cosmic rhythms that influence us. I don't know if you watch Stephen Burns' YouTube, but he talks all the time about what's happening in space and how that's affecting Earth.
Mm.
And in my early career, I had patients that told me that they were influenced by solar flares. And I'm like, what are you
Yeah.
talking about? But now we understand. Roland McCready, taught me how, the plasma from the sun can affect the magnetic field lines of Mother Earth, and that can affect our, energetic system. And people are more and more tuned into that. And then lastly, kind of where I landed is our soul. Again, no matter what you believe in, there's this timeless internal essence of who we are. I call it, the divine, people call it source, God, whatever you believe in. We come from a higher power. That's my belief system. And we are, this part of us that when I'm no longer Christine will, last, and become something different. And we are eternal. And I think a lot of our journey, especially when we're on a healing journey, is to explore these different layers. And why I share that is because healing is not linear. All of us know that. We want to think we get a diagnosis, we do a treatment, we're better. It's not like that. It is a windy journey. And I think the more that you can embrace that you're on this journey and accept it, you can really learn a lot about who you are and where you're going. And also, I think ultimately we're here to explore and have a really strong connection to our higher self, our soul, source, whatever you believe in, which is a guiding, benevolent, unconditionally love source of information that can help us through these times. Earth is always going to be a school. It's always going to be full of challenges. It's always going to be full of, decisions and dilemmas. And if we can really trust our inner navigation system, especially in a time where truth is very confusing, and with AI and all the things, we really have to get good at knowing what is truth for us and what is not truth. And so that's very much where I am right now, Sylvie, with my understanding, but I'm sure it will change. Ask me next year, I'm sure I'll have a whole different understanding, but that's really what I have observed and studied, and what I think healing is about.
So, I mean, this is fascinating, but practically for patients coming to your practice,
Yes.
how do you assess and treat the
Yes.
terrain for them? How do you
Yeah.
help
Yeah.
practically?
Absolutely. I see patients in person and telemedicine, and I kind of have my framework where in the beginning, very much put my doctor hat on, right? I listen to their history, I look at their labs, I'm in the physical body. And throughout the clinical history, though, I'm hearing a lot about them, right? Where their wounds are, where their traumas are, where they're stuck in their body, right? And that gives me also, especially if, someone comes in and says, oh, my mom had Hashimoto's and my grandmother had Hashimoto's. And, that gives me information. Okay. Like there's work to do on, the ancestral level. So I take that clinical history in the labs. I also use bioresonance. So I use two different bioresonance scans, and I also a muscle test. I muscle test in a way that I am always looking at where is the priority, right? Because we can all read up about healing in a book, but when it gets down to our own body, there is a unique blueprint and a unique unfolding that we have to listen to the body to help with. A treatment plan in my world could look like, you know, lymphatic drainage and binders and liver support, going to a biological dentist, getting your
Mhm.
mold in your home tested, but also, do you need to go see an EMDR therapist? Do you need to do somatic therapy? Should we bring in family constellation? What are you doing at home for your electric terrain? What is your EMF exposures taking? Are you creating time to listen? And again, it's very different for every patient, but I'm tuning in to all of those layers and working with them all the time. And so again, it's not all the things that I said are not like linear, like or a hierarchy, but they're all interwoven and they're all in affecting each other. So again, there's so many ways to create high frequency, high vibration water. There's ways to work with the subtle energies in the body. There's a lot of modalities a lot of my patients are all over the country, so I often tune into kind of who's their healing team at home, and it's often someone who works on the physical structure and the electromagnetic structure. Somebody works on the emotional body. Often, I recommend IVs that can look across dimensions, right? From just a glutathione IV to, Weber, right? We use intravenous biophotonic light therapy, right? To help the body. We're always assessing and tuning in. And I'm not only using that in my approach, but also I'm listening from the bioresonance devices that work with resonant frequencies to see prioritization, and also with muscle testing to see where the priorities lie. So, and there's a lot of art in medicine, there's a depth of science, but I always have this experience where I think I know where I'm going. And then, my intuition or the patient's intuition or these therapies give me another angle that I would have missed if I wasn't listening or
Yes, I get
open to
you.
receiving that information.
Yes, this attention. What's the difference for patients consulting you with telemedicine? You said that you have patients
Yes.
from
Yeah.
everywhere, and
Yeah.
those who are close to you. And by the way, can you
Yeah.
tell us where your practice is? When you are facing cancer, the choices can feel overwhelming. Conflicting advices, endless options, and very little clarity. At Maison Beljanski, everything begins with science. For decades, molecular biologist Dr. Mirko Beljanski studied how specific plant extracts interact with cancer cells, work that continues today through independent research and real-world use. Maison Beljanski offers carefully formulated supplements inspired by that research, along with targeted support for immune health, cellular resilience, digestion, detoxification, and overall wellness. You will also find educational books, organic teas, personalized health coaching, and wellness programs designed to support the whole person, not just the diagnosis. This is not about quick fixes. It's about informed choices, thoughtful formulations, and supporting the body alongside conventional care. Explore the products, the research, and the resources at maisonbeljanski.com, because when science leads, wellness follows.
Yeah, yeah, absolutely. So I love seeing people in person, I always do. But, in this day and age, and since COVID, we really had to stretch ourselves, right? To understand that energy, traverses and we are entangled beyond our location, right? And so the bioresonance technology I use can tune into people wherever they are. I've learned to muscle test remotely, which took me
Okay.
a little bit to you'd really trust, but it really
Yeah.
does work. So I really love that. And then in person, I work, I just moved to Boise, Idaho. So I do have an office here. I have a good friend, Sutita Margeron, who has a clinic in the Bay Area who has basically Ebu and Weber, and she just got Dr. Elias's apheresis machine. And, we see patients together there. And I kind of travel and I see patients, at my friends' clinics at this point while I'm setting up in Boise. But in person, I love doing hands on muscle testing. I also do a technique called neural therapy that I would say works on the electromagnetic and emotional layer, also maybe the plasma water layer. And we inject scars, we inject different segmental patterns. You can inject ganglion, we can inject areas of pain and inflammation. And this helps to reset the autonomic nervous system in the fascia. And it's really great with the communication in the body. And so, and people store emotion in their tissues, and that can very much be released and liberated, and that allows the body to have this, a lot of people feel lighter or, more present, and they feel like better in their bodies. So I do that. And then if I'm at Sutita's, we integrate IV work. We also integrate, depending on the therapists that are there, we integrate those therapies as well. But I love in person, but I very much have learned I can see people from, my, home office and get them results, just by working, different locations, which is good for this day and age.
It sounds fantastic. But we have to recognize that there are some people, especially those who are listening to us, who are already in their cancer journey
Yes.
and feel that they're uh, doing everything already. They're doing everything that the doctor is
Yeah.
recommending, and yet they do not get
Yes.
any better. What are we missing?
Yeah.
Can you help those people and make a difference?
Yeah. Yeah.
When cancer enters your life, the questions don't stop at treatment. You start asking why, what else, and what more can I do to support my body? At the Beljanski Foundation, we believe cancer care deserves deeper answers, answers rooted in science, not in shortcuts. For decades, groundbreaking molecular research by Dr. Mirko Beljanski explored how specific natural compounds selectively target cancer cells while sparing healthy ones. That work continues today through independent research, education, and global collaboration. At beljanski.org, you will find evidence-based resources, expert-led conferences, books, and conversations that explore integrative approaches to cancer and chronic disease alongside conventional care. Whether you are a patient, a caregiver, or practitioner, this is the place to learn, to question, and to think more expansively about healing. Visit beljanski.org to explore the research, attend upcoming events, and connect with the Beljanski community. Because informed choices begin with credible science.
And that's, a lot of the people I see, right? And they're also awesome doctors, and none of us are 100% or perfect, right? And we all have our blind spots. And so if you're not getting better, we always have to reevaluate the treatment, right? Are you doing the best treatment at the right time for you? And then often the things that are missed, you could have dental infections or toxicants in the mouth. You could be living in mold. You could have scar interference via. You could also have trauma or emotional stagnation, where you really need to look at your healing as not just a physical experience, but looking at getting support on really letting go of what might be still stuck in your system. I would also look at your EMF environment in your home. I would encourage you to meditate and have a practice where you really get in states of heart brain coherence, which are states when the heart is in a coherent rhythm pattern that entrains the brain. And from that state, we are more powerful, we're more receptive, and we can sometimes get information that helps us align with the healing journey or seeing what was missing. You can get that guidance from within, and you can also visualize yourself getting better. When I was going through my surgery, I did all of these things, but I also did a lot of visualization of every part of my experience and the outcome I wanted to see. Also, I would say I haven't talked about this. I guess it's not exactly part of the framework, but it's important is connection, right? We're meant to live in connection and community. So, illness can be very isolating. So, how can you make an effort to go and lift your spirit up and connect? And then, with the ancestral stuff, that the best way I know, other than maybe some really advanced homeopathics is family constellation therapy. And they're wonderfully trained family constellation therapists. They can work one on one or in a group setting that can help really bring awareness to any trauma that you're still carrying from a past generation. And that can affect your epigenetics. I mean, it's wild, but it can. And then I would say just really feel empowered. You know, there's something in quantum physics called the observer effect. We choose what we observe. Again, there's mystery in life and there's uncertainty, of course. I'm not saying that life is a smooth path, but choose to be the observer of your highest timeline of healing and be open and receptive to finding the answers that maybe you haven't or being led to the person or the people that you need to be led with. And yeah, just remain open and trust that you are on your healing journey. Yeah, I hear you and I know it can be frustrating, but don't lose hope. We're meant to be hopeful and inspired people. And when we lose that our whole system on all these levels really gets impacted. So um, I hope that helps.
Yeah, I love those words of wisdom. Yeah,
Oh, thank you.
absolutely. So you are going to join us in San Diego this summer, June 26 to 29 in San Diego, and we are very much looking forward to having you and to discuss in person those matters. I am sure this is going to add multidimensional approach to an audience which is very much looking for solutions for cancer. And this is going to be really the opportunity to have you able to. I mean, I feel what is important with this event is also to give the opportunity to people to connect with a number of practitioners and hear directly from them what is really
Mhm,
resonating with them
mhm.
and who they want to continue to work with, to heal for this journey. And I'm very grateful that you have accepted to join us in San Diego.
Thank you so much, Sylvie. I was so honored to be reinvited, and we had a great time last year in Austin. And I am so looking forward to San Diego. And I just love the venue and really the buffet of information that you give people. We cross like the very technical research to talking about things that I'm talking about here. And there's a wonderful exhibitors who are always sharing the latest cutting edge treatments and therapies and also things that you could bring at home. And it's just a very approachable and wonderful community. And everyone is there for the right reasons and has a lot of integrity. And so many people need help right now who are struggling with a cancer diagnosis. And we're so on the cutting edge of creating this new paradigm together. And Sylvie has really brought all of these wonderful people together to do that. So I'm really honored to be part of it. And I'm looking forward to San Diego.
Thank you. Thank you so much. And we look forward to having you. Thank you so much, Dr. Schaffner. I think this was very illuminating and bringing a new dimension actually to the healing journey.
Thank you. Thank you so much, Sylvie.
Thank you. Thank you for listening to the Belgian Cancer Talk Show. If this conversation supported or inspired you, please follow the podcast, share it with someone who may benefit, and leave a review to help others discover these integrative perspectives. For more resources and to see what we offer, please visit beljanski.org.